Hello, thank you for inviting me for the Data and Digital Showcase conference. And I'm here representing Science and Business Park Tehnopol from Estonia. And I'm the head of HealthTech, Merilin Varsamaa, who has been working in the HealthTech field for more than 10 years. Estonia is located in Europe. It's close to Finland and Sweden. And we are a small nation, but I would say that our digital capabilities have been expanding quite a lot. So a little bit about myself. I have been working in the private sector at a startup company focused on telemedicine advancements. I also have had the privilege of working at the Ministry of Social Affairs as an advisor for healthcare systems. And currently, I'm also the director of HealthTech at Science and Business Park Tehnopol, but have been also selected out as the technical advisory expert on public health innovation at the World Health Organization. My background is in health promotion, also in health technologies, in developments. So this is my passion that I am happy to share with you as well. Maybe just to dig deep into the key facts about Estonia. So we're a small country, but we are number one regarding digitally advanced societies in the world. And the healthcare here is compulsory solidarity based that covers 95% of the population. The population itself is 1 million people, and the main insurance provider is Estonian Health Insurance Fund. We also have private insurance providers, but they cover approximately more than 60,000 employees. So, but this trend is increasing, and the health tax in Estonia is 13% from the employees. So if you see the population, then approximately half of the population are actually working employees that are contributing to the health tax on a solidarity based. We also have unmet medical needs. The European average is 6%. In Estonia, it's 13%. And there are various reasons for that, which I will highlight also in my presentation. The highest mortality rates in Estonia are cardiovascular diseases, cancer, accidents, obesity, and also mental health. And the challenges are not any different of the challenges that are facing in other countries. So basically, lack of healthcare professionals, access to care, multimorbid diseases, also long waiting lines, and late detection of different diagnoses. And unfortunately, the healthcare system here focuses more on treatment, less on prevention, but hopefully this will be the plan of the government for the next upcoming years. And I'm also happy to share that the Estonian healthcare is 99% of digital. So basically, all of the healthcare public services are digitally accessible, which makes it super convenient to see your own data, book appointments, and also do visitations through telemedicine services. And if we talk about the Estonian health innovation, I guess we should start from eEstonia. This actually outlines also how we operate on a national level. So we don't digitalize only healthcare data, but all of the infrastructure is actually digitalized in Estonia. And this is thanks to the X-Road, which is an exchange layer for registers and information systems. And this was launched in Estonia already 2001. So it has been up and running for approximately 15 years. And it's public, all the public services are accessible 24/7, and different databases and platforms also interact with each others. Estonians also have an ID card that provides digital signatures. So basically, it also helps us to save valuable time, and I would say that Estonians highly appreciate the digital services that we have here, and also have trust in using those with a trust level more than 93% among Estonian people. If we talk about interoperability between systems, the before mentioned X-Road actually enables different systems to exchange data securely. And just to give an example, so if there is a law enforcement trying to access a health system or a tax authority, then they can request data from different registries which are connected through the X-Road, but this definitely has to be a clear request by the law. So every person also sees who has checked their data and for what kind of purposes. And the good thing is that the citizens only need to provide data one time because the system is reused efficiently. And we have also calculated that the X-Road system helps to save more than 1,300 years of working time annually by reducing paperwork activities, allowing instant access, and also letting employees focus on important tasks rather than documentation and so on. And this X-Road is not a unique system. It's an open source that is used internationally, also in Finland, Iceland, and Japan. And today, X-Road has been implemented in more than 20 countries around the world, which is based on the Estonian experience. And if we check the public services available through X-Road, then there are more than 3,000. There are more than 2.2 billion transactions per year. This is also increasing year by year. And we have more than 50,000 organizations as an indirect users of different X-Road services. Here is an overview of how e-health services have been developing in Estonia. So I would say the highlight of the timeline is definitely 2008 when we opened up our National Health Information Center. So basically, this is the central system that actually connects with hospital information systems, clinics, image banks, e-prescription systems. So all the healthcare professionals are required by law to document patients' information there and also exchange data. So this system actually was renewed last year. So we have a more updated system at the moment, and in the future we're also trying to proceed with adding also genome data to make a prediction of different diseases much more faster, so that we're able to also prevent any kind of activities. Here you can also see that we have different drug-drug interaction detection systems. Also, we launched cross-border e-prescription system, which I will talk about in another slide. And last year, we also opened up a platform, so people who have been giving their genome data for research purposes actually received also an overview about their risk management regarding health and what should they avoid and plan ahead. So this is a cross-border data exchange initiative that was launched in 2017. Estonia has joined for quite some years now, and here you can also see that with an Estonian ID card, you're able to move freely around Europe and also share data with local clinics, with local hospitals, and also buy your prescription medicine. So this vice versa data exchange is happening between Croatia, for example, also Greece, Latvia, Portugal, Spain, Finland, and so on. So every year there are new data layers launched as well. Just a short intro about the Estonian biobank. This is the Europe's #1 population-based biobank, and it covers 20% of the adult population. And this actually helps the researchers to support in preventive activities and also treatment in the range of different diseases. Like mentioned before, last year there was a platform opened up for the genome donors to also see what are the health risks for them specifically. So this is definitely one thing we are trying to add also to the central health information system. This is the view of the Estonian health information system. So every resident has their own virtual health space in Estonia. You can log in with your initiatives. It's a very safe method as well. And you can find different topics related to health data, prescription medicine, your dental records, vaccinations, and so on. And you can also book appointments and also directly chat through the channel with your primary care doctor, for example. Here is a view of the, this is a healthcare professional view of the patient. So you can see the inpatient summary here, any information about ambulance, also outpatient visit summary, any side effects of medicines, surgical procedures, also any kind of exams that have been given. So this information is centrally located in the system, and the information is pulled in from hospital information systems, image labs, and so on. I also wanted to share with you that as we are a digital nation, since 2018, we also launched a new government organization called Health and Welfare Information Systems Center. And basically, they are managing over 40 different databases that focus on health, social security, and labor services. So they're always on a governmental level also developing new services from idea phase up to stationary level. So they are serving the whole population here in Estonia, collaborating very closely with hospitals, with clinics, with healthcare providers, and also other government organizations. This is a brief introduction about the Estonian Health Insurance Fund. So they are providing different healthcare services that are covered by the fund activities. They also support and prevent diseases, also plan financial statements to purchase different medicines, and also provide technical aids to provide temporary incapacity benefit and other benefits to people as well. And their main goals for this year is also to design better patient journeys. If we talk about health journeys, treatment journeys, also digital journeys to proceed in providing the highest quality of healthcare in Estonia. I also wanted to highlight some of the telemedicine pilot projects that were covered by the Estonian Health Insurance Fund last year. So these were very successful projects, and I will highlight 4 main here. So one was for a family doctor center, which was a proactive health journey. And during that pilot, they did a digital tool for secure patient and doctor communication and chronic care management. They supported creation of personalized health plans through motivational interviews. And this pilot study included 400 patients that were randomized into intervention and control groups. And that it's still now currently being used by the Family Doctor Center, and also is acceptable through other family doctor centers. This is another project that is done together with the largest Estonia hospital called North Estonia Medical Center, which is the Kaiku Health digital platform. And this is actually for a remote service model planning for patients who are receiving cancer treatment. And the results that actually came was that there was increased trust in nurses and their experience regarding using this chat between patients and doctors. AI complements patients' interactions with the medical team in the care pathway, and this platform also helps to reduce patients' anxiety during treatment and provided faster information between patient and doctor. This is a third piloting between Tartu University Hospital. So this was for comprehensive monitoring for psoriasis patients. And for this project, there were more than 150 patients that actually used the tool, and the results were that the average insurance costs were actually lower for severe patients. 87 patients were satisfied with the use of the tool, and the project actually included a remote monitoring for psoriasis patients by using DermTest image viewer for sending skin photos and symptom data for healthcare professionals. And this kind of a model empowers patients, also supports timely care, and is user-friendly for both patients and healthcare professionals. And the fourth project was pre-visits. So this actually helped to plan better clinical and digital triage services that are based on symptom questionnaires and also health tickets. And this actually provided better access for both parties, helped to save available time. And these pre-visits were actually available 24/7 with self-analysis, symptom input, and also triage module guiding on urgency and also next steps. And in 2022, there were more than 30,000 patient contacts, and approximately a third of these were completed with the symptom questionnaires via Minodoc platform. And this actually used showcase to increase response time for simple issues and also better plan our healthcare resources. As I mentioned in the beginning, I'm working at the Technopole Science and Business Park, which was founded in 2003 by the state government, City of Tallinn, and Tallinn University of Technology. And we have a large business campus where we have more than 200 companies located there. We're close to the university. We also have different laboratories to test different technologies, and we provide services from idea level up to corporate level as well. And the focus fields are health tech, AI, digital solutions, and dual use and defense. If we start from the very beginning, then Estonia is a startup nation and is a gateway to Europe as well. And we have a variety of startup ecosystems with different kind of events. Since 2006, we have raised more than 4.4 billion euros. Among those startups that are founded in Estonia, approximately there is more than 1,400 startups in Estonia. And we also provide startup visas for 5 years on quite easy terms for also third countries. And we launched an e-residency program, so every person who wants to start an EU company can actually do that online. And the Startup Estonia program is funded by the European Regional Development Fund. This is an overview about the 10 unicorn companies that we have here in Estonia, and also the time frame when they reached unicorn status. And in Tehnopol, we also have a startup incubator program also running for the past 14 years already. It's a 6-month program. We have had more than 800 alumni startups, and the success rate is 60%. So after 2 or 3 years, they are still alive and providing their products and services on the market. We are also closely working with the defense sector. So we are also the main partners for the NATO Diana Acceleration Program. And this is an equity-free grant that provides support for companies in dual-use technologies. And if we proceed from here, then Tehnopol has the largest HealthTech ecosystem in the Baltic states that connects with more than 65 members who we have direct contracts with. So hospitals, clinics, pharma companies, startups, also public sector partners. And we organize more than 20 different events every year and have been in the health innovation ecosystem for more than 10 years. Here is outlined an overview what we do to support the development and success of health tech globally. So various connections, collaboration with international partners, access to capital, to export markets, and we're also always trying to find new funding opportunities as well. This is an overview of the startups, hospitals that we have that are closely collaborating with each other. And I also wanted to outline 3 main focus areas that actually came from the Estonian e-health strategy. So one is this human-centric approach in healthcare. The strategy itself is for 5 years, 2025 until 2030. And among this focus area, we have also launched a lung cancer patient pathway project, which was a public-private partnership between hospitals, pharma, public sector, and patient organizations. So it was a very large database analysis of also identifying the needs of novel solutions and technologies to proceed with. And this project actually proceeded with standardization through Estonian Health Insurance Fund. And now the main partner, Tartu University Hospital, is actually leading this initiative. Secondly, an important topic regarding Estonian e-health is data and artificial intelligence. And among this, we also have a project that is in connection with European countries. So basically launching a medical device, which is a lung shirt connected to a platform to showcase real live data from the patient that actually lands to the doctors or healthcare professionals platform. So this actually helps to save valuable time, reduce waiting lines, and also support in preventive activities for the COPD patients. And the third one is definitely mental well-being. Among that, We have the large project with the largest Estonian hospital called North Estonian Medical Center, and there are more than 5,000 employees there who have now access to this solution since this year, from March. And this actually supports the well-being of healthcare professionals at work, provides different meditation and mindfulness sessions, and overall support. And here you can see that Estonia shows that digital health is not just about technology, it's about trust, usability, and governance. And thank you